Good morning. I'm Tanya Saffer, Head of Government Affairs and Market Access for Outset Medical, and I will be the moderator for this discussion on how kidney disease worsens health disparities and how Outset Medical and the National Kidney Foundation have teamed to intervene. Thank you to the organizers of the Health Equity Summit for recognizing the impact kidney disease has on health disparities and the lessons that can be gained and applied to broadly address health disparities. Before I introduce our panelists, I want to set the stage for why a focus on kidney disease, given the magnitude of health conditions that disproportionately impact people of color. Kidney disease is itself a multiplier and contributor to worsening health disparities. The impact of socioeconomic status and living conditions is a contributor to health disparities, and that dramatic impact can be seen in kidney disease, with over a third of people with kidney disease living in impoverished areas. Add on to the multiplier effect is the COVID impact. The first US reported deaths due to COVID-19 were in dialysis patients, and mortality grew exponentially in patients receiving dialysis. The vast majority who receive dialysis in clinic 3 to 4 times per week. These clinics can be as large as 30 or more patients treating at one time. And patients receiving dialysis or who have a kidney transplant are covered by Medicare, regardless of age. And when compared to the overall Medicare population, they had the highest rate of hospitalizations, and the surge of mortality during the pandemic for ESRD patients has been devastating. Home dialysis is an option to patients, but remains inaccessible for many. This lack of home dialysis adoption is further worsening disparities and keeping those in poverty from being able to climb out, as most patients receiving dialysis are unemployed. Home dialysis fulfills the quadruple aim, which we know is the gold standard in achieving healthcare quality. Home dialysis is associated with being 5 times more likely to maintain employment. In particular, home hemodialysis provides the ability to deliver personalized treatments that are associated with improved health outcomes, and also allow the flexibility to fit dialysis around patients' lifestyle and commitments. It's a lower cost modality as it requires little infrastructure to establish a home training and support program for patients, whereas traditional in-center dialysis requires entire rooms dedicated to water treatment, equipment, and staff. And clinicians have the potential for greater satisfaction of providing patients with a treatment option that they would choose for themselves. People of color are less likely to receive a kidney transplant or have access to home dialysis. In an ideal world, this would all change. All patients, regardless of race, ethnicity, and socioeconomic status, would have access to the best primary care and nephrology care, where kidney disease could be identified early and its progression halted through self-management, education, and medication. When earlier intervention does not work, self-management education would help patients understand and choose the treatment for kidney failure that best aligns with their healthcare goals as well as their personal lifestyle goals. The gold standard for health outcomes being a transplant. Unfortunately, there are not enough kidneys available for everyone to receive a kidney transplant. And yet this is another area where Black and Brown patients face disparities in access to the highest quality healthcare. You can see that out of the number of ESRD and stage renal disease patients in the country, the number of patients Black patients that get a transplant is 21% versus 33% of white patients are able to get a transplant. In home dialysis, you also see that disparity. And this is just an example as well as other race and ethnicities are disproportionately impacted and affected with lack of access to transplant and home dialysis. So in home dialysis, 9% of Black patients are utilizing dialysis at home today, and 14% of white patients. And so really the vision here is we have goals at Outset. One is to reduce unplanned starts by 20%, meaning that patients are entering into kidney failure knowledgeable, aware, and have the self-management skills to choose the treatment option that will work best for them. We want to increase the number of patients that are eligible for transplant by giving them better outcomes and better control over their own care. And we want to improve those that do need dialysis. There should be 50% at home, not the 12% that we see in the US today. And then we want to clearly eliminate these disparities in transplant and home. So we decided to look at what are the most critical barriers that are preventing us from achieving that ideal spectrum of care. And one is lack of awareness. Lack of awareness of their kidney disease, given that we see that 60% of dialysis patients crash in with little to no knowledge of their kidney disease beforehand. That crash happens more often in people of color, highlighting a critical need for disease education and awareness of those treatment options. African Americans in particular are less likely to fully trust the medical community. A recent National Kidney Foundation survey of dialysis patients further supported this and showed that activated Black patients are more likely to seek education outside of the medical community. Bias exists among providers about patients' ability to engage in home dialysis, often thinking through who are the right patients suitable for home dialysis. Among clinicians, this can lead to self-doubt among patients, when in reality, there is no clinical contraindication for doing dialysis at home, and socioeconomic barriers are surmountable. So knowing this, we at Outset approached the National Kidney Foundation of Michigan, who has a long history of tackling health disparities and leading community-based programs to achieve results. And we asked them to tackle these barriers that are leading to disparities in home dialysis use and transplantation. And with that, I'm very pleased to introduce our panelists, Leslie Trigg, CEO of Outset Medical, and Caitlin Lockery, Senior Program Coordinator of the National Kidney Foundation of Michigan. Thank you, Caitlin and Leslie, for joining today. I know we're all very excited to be part of this panel discussion and raising the awareness about kidney disease and disparities. So I'm going to kick us off in the interest of time with a first question, and I'm going to direct it at Leslie. Why is improving access to home dialysis among socioeconomic and racial and ethnic minorities important to Outset, given that we know addressing inequities in care is more challenging than identifying a patient population that may have an easier time accessing home dialysis?
Yeah, thanks, Tanya, and thank you to the conference organizers for including this topic to begin with in the conference. I think it's really, really important and often overlooked. I think, Tanya, the answer to your question is, first and foremost, we are an organization that is really grounded in and completely centered around a strong moral mission. Every company for-profit has a financial mission, but at Outset, we're really centered around the moral mission and always have been, which for us is to restore the dignity and the identity and a sense of self-worth by enabling patients to control and own where they dialyze, when they dialyze, and how they dialyze. And so as we got deeper into learning about the conventional dialysis industry, because many of us didn't come from a dialysis background, so we were learners in the field, it just became more and more apparent to us that traditional in-center dialysis made it even more difficult for white, but particularly non-white patients to achieve the moral mission that we had set out for ourselves. And so we started to realize that in order to achieve the vision that we had, that we believe in, we needed to tackle home dialysis access, the disparities around access, and ensure that all patients have the ability to control when, where, and how they dialyze, which is not the current state today. I think second, we do tend to gravitate to hard things for whatever reason. We've never really played for the path of least resistance, but more so for affecting profound and permanent change. This is a space that really hasn't changed much in 30 or 40 years. So I think that fundamental change, which is hard and messy and ambiguous, is sort of in our DNA.
Great, thank you for that. And Caitlin, I'm going to direct the next question at you. We approached the National Kidney Foundation of Michigan, recognizing that the Kidney Path program that you run is unique and has really the opportunity to empower patients with knowledge, but even beyond that, really make a change and a difference in addressing inequities in healthcare. And so I'm going to ask you, can you tell us a little bit more about the approach to Kidney Path? What's unique about it versus information a clinician might deliver? And what evidence do you have that this will address the disparities? And then last, how are you measuring effectiveness?
Yeah, definitely. Well, good morning, everyone. Good to be here. So Kidney Path, I'll just start by telling you a little more about it. It's a program that's grounded on an evidence-based program called the Chronic Disease Self-Management Program, or CDSMP. This was originally developed by Stanford University, and it's implemented internationally and really thoroughly evaluated. Kidney Path is an 8-week program, meets for about 2 hours per session. Some things that make it unique, I think it's led by lay leaders, who themselves are living with kidney disease. So they are going through the same things day to day that the participants are, and they really become like trusted members of the community. An overarching goal of the program is to help participants become active self-managers of life with kidney disease, and really to encourage them to advocate for themselves. And when they're working with their healthcare providers, really develop a partnership, improve that communication. And it's a lot focused on self-efficacy. So, giving people the confidence that they can do things like make healthy, choices in their nutrition, be more physically active, communicate with their healthcare providers, understand their emotions, and a number of other things. And we kind of do that through what we have called the self-management toolbox, so after this 8-week workshop, participants practice using all these skills and tools and come away with this. Fortunately, it's not a physical toolbox, but this box of tools that they can use throughout their lives, living with kidney disease, and because they're managing their condition every day. Actually, we do action planning each week, so really breaking down some of those larger health goals into more manageable, actionable items. And they're talking with their peers about any of the barriers or their fears that they're facing, and helping them prepare for those communications with their providers. So that social support, accountability, and education are really a lot of the things that makes it unique. Quickly, I know you mentioned evidence too. I can say from our experience at the Kidney Foundation, about 33% of the participants who both enrolled and completed the workshop are from racial and ethnic minorities. We have statewide reach now, and in person, I think we've been leading Kidney Path since 2014, primarily in Southeast Michigan, but we're out in the community in Detroit and in neighboring communities, and really reaching people of all different backgrounds. And lastly, I'll just touch on evaluation. Again, we're really looking at self-efficacy, and that's self-reported. We're asking about treatment options. So asking about people's knowledge. Did it improve? About their feasibility of the different treatment options, including obviously home dialysis, their likeliness to adapt that treatment option. Do they have enough support? Social isolation, and also just looking at general program satisfaction and collecting testimonials.
Thanks, Caitlin. That was a very thorough response to my 3-pronged question. So I appreciate that. And I think that last piece that you touched on is the new part here, the collaboration that we're working on together, which Kidney Path has been for a long time an evidence-based, grounded in evidence-based disease self-management program, with additional kind of layered on kidney disease specific education delivered by somebody that is living with kidney disease themselves. This new curriculum, which educates on the treatment options, is what was missing prior to that program. And so I think this is, you've hit on, this is a great opportunity for us to build the evidence to show that does enhancing and improving self-management skills increase the amount of patients and reduce that can achieve getting on the transplant wait list earlier, as well as selecting home dialysis. And so this is something we're looking forward to testing in the pilot. So thanks. I'm going to ask the next question of you first, Caitlin, just to build on that. Why the focus on home dialysis as a way to eliminate disparities? Do you believe more patients want to go home? And if so, what's keeping them from doing so?
Yeah, I definitely do think people do want to be at home. I mean, I know there's so many barriers to in-center. I just talked to a lot of patients who have transportation barriers or, are there and just kind of the atmosphere isn't always the most positive, outgoing. But I think some things that keep them from doing it are definitely a lack of education and awareness. I talk with people, especially people who are more newly diagnosed and may not even realize that home dialysis could be an option for them. And definitely also a lack of empowerment. Like the participants I talk to are often feeling so overwhelmed by the new diagnosis, all the information being thrown at them. They're living a new lifestyle, thinking about their diet. They can't do the things that they used to be able to do. And they might be encountering other barriers and just feel like, I don't know, it just isn't an option for them, or that they're not getting the support or encouragement or the empowerment to make that choice. So I think something with the kidney path is really providing that education and again, encouraging people to really be advocates for themselves and make the choice that'll be best for them. If that is at home, and if they do want to go home, that's something they can do.
Yeah, I like that the component of teaching people to be their own advocates, which can help them and arm them with overcoming some of the things that we know are barriers to home dialysis, like bias among clinicians around whether or not these barriers are insurmountable, right? So hearing from a peer and participating in community-based education can really empower somebody to look at their situation differently and more positively instead of I can't, have more of a can-do attitude. Leslie, I'm going to ask you the same question. Why the focus on home to eliminate disparities here? And do you believe more patients want to go home?
Yeah, I do. I really do. And I was really interested in hearing kind of Caitlin's eyewitness reports of people feeling like they're not capable. We have firsthand experience both through a clinical trial that we had to run to get clearance by the FDA for home, and also now seeing patients using our device Tablo in the home, that virtually anybody is capable and competent enough to manage their own care in the home. I just don't see very many barriers from a technology standpoint or a capability standpoint. Everybody should be able to do this in the home. But I think it does start with education, and I think it does start with transferring that conviction and belief to somebody else, which is what the PATH program is doing such a good job of. So why the home? What we saw in this clinical trial that I just mentioned, we actually had in the trial 70% of the patients were non-white. And so that's an interesting opportunity to study, were there any differences in safety and efficacy between a white and a non-white population? No. Was the patient interest in home dialysis the same or different? The same. Was the patient's ability to stay on home dialysis different or the same? It was the same. And yet, and as you mentioned, in the real world, the statistics on the percentage of white versus Black uptake of home dialysis is different, and it's lower in non-white populations. So why is that? Well, it's not because the outcomes are any worse. We know home is better for lowering mortality and restoring somebody's ability to return to work. I mean, Tanya, you also delivered that very sobering statistic about how few people are able to work on dialysis. And that's because they're told in an in-center environment, what day, what time, what chair, who's going to help them. I mean, you have robbed somebody of control over their schedule or even creating access to being able to work. And so I think the most powerful motive we have on getting more patients to home is actually giving people, one, again, agency and self-worth, but also an ability to work. Or an ability to engage in kind of the life enriching activities that frankly sort of constitute life for most people, quality life. So that's why we're focused on home dialysis, lifeline to employment and a lifeline to what makes life worth living.
Thank you. That was a fabulous answer. Couldn't agree more. And one of the things that the next question I'm going to ask both of you. One of the things I love about my job is I was previously at the National Kidney Foundation leading health policy. and before I moved to Outset. And I've had the opportunity to continue to work in the public health field and work with the National Kidney Foundation in my role at Outset. So I wanted to talk to you guys about what their corporate commitments and actions to addressing equity, inclusion, and diversity are proliferating now, following the rise and rising focus on racial tensions and the killings of Black Americans. Many healthcare organizations are channeling their commitments towards addressing health disparities, including Outset Medical. And many, so what I want to talk to, or what have you guys, talk to the audience about is, what are the benefits of Outset and NKF of Michigan's partnership in addressing health disparities? And what advice would you take from this collaboration and give to others in the healthcare industry at large and the public health field about working together? Caitlin, do you want to take that first?
Sure. I'll just say, as someone, at a nonprofit community organization and, in the public health field, I think we can't do our work in isolation. We try to offer these great programs like Kidney Path, and, we can kind of try to empower people all we want. But what good is it if we can, empower someone to really take charge of their health? Maybe decide they want to do home dialysis if there isn't like a quality product out there that's accessible and available for them. And I think that works in reverse too, right? From Outset's perspective, if they've got a great product, but there's these barriers to accessing it, people don't feel like it's right for them or one way, then or don't have the education. So I think we can really support each other in that way. And also, just for the Kidney Foundation, I think it's so important that, we're out in the community, we're talking with people living with kidney disease, that, I want to be aware of the projects and the services that are out there for people, so I can help support them, live the best quality of life, like Leslie was saying, while living with kidney disease.
Thanks, Caitlin. That's helpful. So just to summarize before I flip to Leslie, really the powerful and impactful way of industry and public health working together is being able to utilize and kind of share resources and knowledge and be able to pass that along to patients. Leslie, I'll ask you the same question. What advice would you give the broader healthcare industry community and the public health community about working together?
Well, I echo both of your comments. Shortly said, stronger together. I think no year, perhaps beyond 2020, taught me, and I think all of us, that there is no one organization, whether it's the government, for-profit or nonprofit, has all the answers, all the tools, and all the resources. And when we look at how many different dimensions of society, came together around the pandemic, I think that is a very convincing example of the power of bringing different and complementary skill sets and strengths and sort of unifying toward a common goal.
I love it. Better together. Great. Yes. All right. So last question for you both. And then I will actually invite the audience to share questions in the chat, and we will be answering those questions live for you via the chat. So last question from me. Community-based education to reach patients can create meaningful change. What are the other steps that the community at large can take to achieve health equity for kidney patients? And Leslie, I'll let you go ahead and go first, and then I'll pivot to Caitlin.
Yeah, sure. Well, our own efforts are obviously multifactorial around trying to eliminate, at least first reduce, the racial disparities in access to home dialysis. And we're taking a multi-partner, multi-channel approach. But maybe with the limited time we have left, I think there's something that we haven't touched on yet that is important to say, which is that the government, in this case, does have an important role to play here too. The previous administration had put a very much needed real spotlight on the management of kidney disease and followed it up with some very concrete and progressive programs behind it that were designed to kind of flip the script, if you will, and change the financial incentives, which today really drive patients still toward the in-center kind of assembly line model. One of these programs is called the ETC, the ESRD Treatment Choices Model, that it does incent clinic providers and other healthcare providers to move more of their patients onto the transplant wait list and or onto home dialysis. So I think we are already seeing that's having a really positive impact. I think the Biden administration needs to continue to support these efforts, enhance these efforts to increase access to transplant and home, and continue to advance the ETC model in order to ensure that we don't just regress back to the path of least resistance. So again, I'll just close with with a plea that the Biden administration kind of continue the good work that was started in the last 2 years and find ways to amplify and incent providers to continue to drive more patients and provide more access to transplant and home dialysis.
That's a great call to action, and thank you. These policies and this focus on kidney disease had wide bipartisan support, and I think underscores that we can help achieve the Biden-Harris administration's goals to accomplish health equity by continuing to focus on the work that was put into progress. To change this incentive and this structure around, just everybody straight to home dialysis. That's great. Caitlin, I'll let you have the last word. So same question. What advice, what other steps can the community at large take to achieve health equity for kidney patients? And I know you all are doing quite a bit there too.
Thank you. Yeah, and I guess I can kind of share some of the other goals and the work that we're doing here at the National Kidney Foundation of Michigan. Because really, health equity is really ingrained in our mission and in everything we do. So in addition to Kidney Path, we offer a number of prevention, community-based prevention programs really across the lifespan, everywhere from kids to older adults, programs that focus on kidney disease and the other comorbidities like diabetes, hypertension, heart disease that are all connected. And so really prevention efforts to help people, live the healthiest lives that they can. We're also really focused on living donation and transplant. So again, providing that education and awareness about those options along with home dialysis. And let's see, a few other things, we're offering COVID vaccinations among people in dialysis. We also have what's called a REACH grant, a racial and ethnic approaches to community health from CDC that's, again, focused on those policies, systems, and environmental changes to help build healthier communities where we're at in Michigan. So yeah, we're definitely, just health equity is really, really a focus in a lot of ways. It's a big question. There's a lot that can be done.
Yeah. So maybe if I were to summarize a call to action for you, it is to really continue to support our public health infrastructure through grants. And that can be another call to action among policymakers, is to really invest in our public health infrastructure, our ability of our community-based organizations to carry out these community programs that are so important to achieving health equity. So I want to thank both of you for your time today, again, to the organizers of the Health Equity Summit and to our participants in the audience, and also call another action on our participants. Please put your questions in the chat. We're happy to answer them with you and continue the dialogue. Thank you all today for your time today.
Thanks, Tanya.
Thank you.